Welcome to A Healthy Dose. Today, we're diving into the relationship between diet and our menstrual cycle. For many of us, the menstrual phase can bring a range of physical and emotional challenges from cramps to fatigue. But did you know that supporting your body with the right foods during this time can make a world of difference? We'll break down the phases of each cycle, what happens hormonally, and how we can nourish ourselves through it. I'm Julie Stelman, and today I'm joined by Behnaz Beigui, a Toronto-based functional nutrition counselor and health coach, specializing in SIBO and Candida overgrowth, histamine intolerance, and food sensitivities. Welcome, Behnaz.
Thank you for having me.
So listen, let's jump into this.
Yeah, of
Week
course.
one, the period, the time that every woman dreads. Let's talk about
Yes.
it. That's usually around what?
Yeah.
Days 1 to 7? Is that normal?
Yeah, that's correct. So this is our this marks our cycle actually. The menstrual cycles begins with our menstruation, that phase, and it marks the day one and it goes up to 7 days for most people. Again, every person is different depending on their hormonal status and their health issues. But I would say it lasts about 1 to 7 days, and that's where we get a lot of either the cramping and the PMS symptoms and the mood swings and an
Yeah.
energy drop in most people. And in severe cases, we also see depressive episodes and like anxiety.
So
So
let's talk about that. Like,
yeah.
why are some of these, why do we have these symptoms, first of all? And why do some women have them more than others?
Yeah, of course. So you know, our bodies are so delicate, especially as women. We have two rhythms. We have the circadian rhythm and we have the infradian rhythm. So the infradian rhythm is where we have our menstrual phase, right? The 1 to 7 days, and it lasts more than 24 hours. And we also have our
Mm.
circadian rhythm. So when you combine the two, we have things that are really important for it. For example, sleep, stress,
Mm.
um, like hormonal cravings, and also sugar cravings, also that blood sugar balance that we really want to have. So a lot of cravings come into this, but also we have these hormones called estrogen and progesterone, and we need to have the right dose and balance between the two prior to the menstruation phase. So when we have that imbalance, usually we're not going to struggle so much with the PMS symptoms or the menstruation phase because it's not
Okay.
supposed to be painful
Okay,
and
so
it's not
that's the
normal.
big question here. Is it
Yeah,
supposed to be painful?
it's
Is
not
it
supposed to be.
normal to be extremely
It
painful?
is
Should we?
accepted, and
It's
it is,
accepted.
yes, it's accepted and normal to have pain. It is normal in the sense that women struggle with this, and
Mm.
it's actually it's perfectly normal. But is it normal for us to go through the pain that much? No, that's where we need to really question, why is it happening for us like this? What's the root cause of it? And we
Mm.
really need to like really investigate and talk to our healthcare practitioners to see a gynecologist also, and to work with a healthcare practitioner that does integrative medicine or like a naturopathic practitioner, and to really look at the underlying inflammatory markers, look at
Mm.
our insulin levels, look
Okay.
at our protein intake, our sleep, our stress, the traumas that we deal with also that
Mm.
comes into play. So this is a very important phase, and this is also where we see a drop in progesterone and that
Okay.
peaceful hormone.
Okay.
So
So the peaceful hormone.
yeah,
Okay.
so we have that, and estrogen may rise actually.
Mm.
So, or it could be that we didn't have the balance in to begin with, so the ratio gets off. But this is a phase where progesterone drops gradually, and
Okay.
so that's where we get the painful cramps, and we're not actually getting rid of that excess estrogen that we're meant to get rid of, because
So
estrogen needs to leave.
so let's look at food for a minute.
Yeah,
What nutrients should we be thinking about in this phase when we're
right.
having our period? That what should we be eating? What should we be focusing on?
So this is the phase where we're going to lose a lot of iron because we're bleeding,
Okay,
right?
right.
So as
Yeah.
our, the lighting of the uterus sheds, and we're
Mm.
bleeding, so we're going to be losing a lot of iron in this
Hmm.
phase. And so this is where I focus on your grass-fed beef. So I would say like really get quality proteins, but beef is great, but it has bioavailable iron, which supports us. And we also really want to focus on magnesium rich foods like chocolate and cacao
Yeah.
powder and cacao
Now you're
beans.
speaking my language.
Yeah, exactly. Like who doesn't love chocolate? Chocolate is fantastic, but there's good reason why we intuitively
Mm.
gravitate towards chocolate also, because it's magnesium rich, and we can also look at diversity, bring in a lot of fiber.
Sounds great. Well,
Yeah.
stay with us. We're going to be right back with phase two.